Welcome to the Brazil-Malaysia Equitable Access to Medicine Seminar. First of all, I would like to ask our host, His Excellency Ambassador Norton de Quintella, to take the floor for his opening remarks. Thank you, Ambassador.
Good morning, everyone. Thank you all very much for participating in this seminar organized by the Embassy of Brazil on equitable access to medicines. I would like to thank the presence amongst us of my friends, the ambassadors of Norway, Spain, and Chile. March 8th is always an important occasion as we commemorate International Women's Day. The Embassy of Brazil was honored yesterday to collaborate in the International Women's Day Forum organized by the United Nations in Malaysia. Respect for women and women's rights is at the center of Brazil's political agenda. Since January 1st, 2023, the administration of President Lula has reiterated efforts to address gender-related inequities. The Ministry of Women was created as a cabinet post dedicated to women, and the government of Brazil has launched a comprehensive interministerial package of gender-responsive policies with 25 actions aimed at empowering women. The promotion of gender-responsive public policies is related to the matter we are discussing here today, which is access to medicines. The inequalities in access to medicines and medical products affect women in a disproportionate way. In Brazil, the gender pay gap between men and women is estimated at 22%. Different studies have shown that approximately half of Brazilian households have women as their main provider, with more than half of those being Black women, which in Brazil still means women most likely to be underprivileged. If we take into consideration that Brazilian families' expenses with private health care represent nearly 6% of GDP, a number that is twice as high, more than twice as high as the OECD average of 2.3%, we can see how the lack of affordability of healthcare and the socioeconomic situation of women are deeply connected. Just as the current Malaysian government, the government of Brazil is investing in tackling the health challenges that affect women. Currently, Brazil has its first female Minister of Health, Dr. Nízia Trindade. Last February, Minister Nízia Trindade launched the National Strategy of Prevention and Elimination of Cervical Cancer, based on expanding vaccination against HPV, with a goal of reaching 80% of the target population. As Malaysia, Brazil is determined to eliminate cervical cancer as a public health problem. In this regard, we took part, Brazil, in the Global HPV Consortium launched here in Kuala Lumpur last year in September, and we look forward to working together with Malaysia in this area. Malaysia and Brazil find themselves in a similar situation. Our countries are both classified by the World Bank as upper middle-income countries, with Malaysia very close to reaching high-income country status. Both governments have a commitment to ensuring the right to health, providing solid governmental financial support to guarantee medical products to their population. In Brazil, for several deadly illnesses, the public health system provides free medicines for all, and the Brazilian government funds that. But production and research in the pharmaceutical sector is still highly concentrated in the global north, which accounts for more than 70% of all research conducted. The paradox that affects upper middle income countries was stark during COVID-19. Brazil and Malaysia, which do not host large pharmaceutical companies, reserve significant resources to procurement of medical products and vaccines. And despite being willing to pay similar prices as developed countries, we were left, Brazil and Malaysia, in the back of the line, which place large segments of our populations in vulnerable situations. That is why Brazil has set the goal of producing 70% of its demands for medicines, vaccines, and medical supplies internally, while at the same time committing to technology transfer and open innovation in health. Brazil is also enhancing its preparedness to health emergencies, aware of the challenges in the coming years associated with climate change, emerging infectious diseases, and non-communicable conditions. An example of this challenge is the current dengue emergency in Brazil. To address it, the government of Brazil has allocated $300 million to support local governments in dealing with the emergencies this year. The government of Brazil has also acquired 6.5 million doses of vaccine for 2024 and 9 million doses for 2025, and created the Arbovirus Emergency Operations Center to monitor cases of dengue, Zika, and chikungunya, and coordinate response actions and clinical management of patients. Brazil also extends its full support to the Dengue Alliance, a project that unites Brazil, Malaysia, Thailand, and India, and Drugs for Neglected Diseases, DNDi, in research and development for treatments against dengue. Just this Monday, we had here at the National Institutes of Health, the Dengue Visibility Research Day. These discussions are central to the priorities of Brazil for our G20 presidency this year. The Health Working Group of the G20 under the Brazilian presidency is focusing on how local and regional production of medicines contributes to pandemic preparedness, as well as on the impacts of climate change on health. Brazil this year, as the chair of the G20, has invited Malaysia to be a member of a bioeconomy initiative within the G20. And meetings have already started, and Malaysia is participating in that initiative at the invitation of Brazil. The Bioeconomy Initiative is a forum that will discuss, amongst other topics, how bioeconomy plays a crucial role in ensuring equitable access to essential medical products. Malaysia and Brazil are currently deepening their dialogue in several areas. And I'm a firm believer myself that the health sector is one of those promising areas. And we've been trying at the embassy to deepen the dialogue between Brazil and Malaysia in the health sector. So I believe that the debate we're having here today, and once again, thank you all for being here, this initiative that the embassy is hosting today represents a cornerstone for the cooperation between Brazil and Malaysia in the health sector. The links between our countries are historical, geographical, natural, and political. In the current scenario of an international order that is being put into an extraordinary level of tension due to geopolitics and climate change, countries in the global south must put in the effort to cooperate and to work together, multilaterally, bilaterally, or within like-minded groups, to recenter the debate on international development and autonomy for all peoples. I believe that guaranteeing health and well-being for the populations of all countries is part of our collective goals as an international community. The closing remarks at this seminar will be given by the Deputy Minister of Health, Dato' Lukanisman bin Awang Sauni, who will join us later this morning. And we are privileged to have here also with us Dr. Marco Krieger, who is the vice president of Fiocruz in Brazil, which is the state institution that promotes access to vaccines and which is also an important pharmaceutical producer. So I'm happy to give the floor to Dr. Marco Krieger. Thank you.
So, first of all, I would like to thank you all, but mainly thank you, the pastor of Brazil here in Malaysia, for this. We have a very good opportunity to share our experience in both countries. I think Brazil and Malaysia will share a lot of capabilities, perhaps some same problems, and I think if we can discuss the way to try to solve and to tackle and to face the situation will be really important. And I am almost sure that after this week, we will be able to have a strong collaboration between Malaysia and Brazil, mainly because the work of the Brazilian embassy that are trying to put together our team. So I will just give you a very fast idea about my institution. And the first point that I would like to highlight is that Lisa Trindade is not the first woman that is Minister of Health in Brazil, but was the first woman to be the president of the Oswaldo Foundation before. So our institution has 125 years and was created to face a very dramatic sanitary situation in Brazil in the beginning of last century. At that time, in Rio de Janeiro, we have at the same time the plague, the smallpox, and yellow fever outbreaks. And Oswaldo and the Brazilian government decided to create institutes to produce this serum. So one important point in our DNA is that local production is part of our history since the beginning. And it was important because we do not be able to have this product for the Brazilian society. But Oswaldo Cruz and his colleagues at that time, in less than 5 years, they were able to control the three epidemic situation in Brazil. And we used to say that Brazil's Oswaldo Foundation, Fiocruz, is not the beginning of the scientific activity in Brazil, but was the first time that the Brazilian society realized that science can be used for the improvement of quality of life. So this is also a part of our DNA, try to use the best science to improve the quality of life of our population. Oswaldo Foundation has a very complex ecosystem. We work from basic research until the production of medicines, biodrugs, vaccines, and diagnostics. And we have also inside our institute two hospitals, the National Center for Infectious Disease, National Center for Mother and Children Health. And we used to say that we play the role of the NIH in Brazil because we work a lot in basic research. Also, the play of the CDC, because almost 70% of the reference labs for surveillance in Brazil are located inside the Oswaldo Foundation. Part of the role of the FDA, because the technical arm of the Visa, our FDA, is located also inside the Oswaldo Foundation. And in addition to this, we have the National School of Public Health and two production facilities. So this complex ecosystem is one of the tools that Brazilian society use to guarantee the access to medicine. And I think here today we will have the opportunity to show you part of this ecosystem in Brazil. Also, part of the national policy support the local production, the policy of the economical and industrial complex in health. And I am almost sure that we will have a lot of opportunities to discuss during this day in order to improve the connections between Brazil and Malaysia. So thank you all for coming. Thank you, Ambassador, for inviting me here. And I wish you all a very good